Thank you, Senator. Senator Ossoff.
Thank you, Madam Chair. Thank you for convening this hearing. It's powerful to be in the presence of so many young people. Thank you for being here with us and for holding elected officials accountable through your presence and your example. And thank you to our witnesses as well. Dr. Rogers, NIH collaborates with CDC on the special diabetes program, correct?
That's correct, Senator.
And have you had positive working relationships with many of your colleagues at the CDC?
Very positive relationship. I mentioned one earlier on, the search for diabetes in the youth, which has been funded through this special diabetes program. And it's not only detecting that there has been over time an increase in the incidence of type 1 diabetes, but also in type 2 diabetes. What I was taught when I was in medical school, we called it adult onset, but we're seeing this now in kids 10, 12, 14. And that would not be possible without the collaboration that's long-standing now with the Centers for Disease Control.
And appreciate your work at NIH. And the CDC does vital work for the nation, yeah?
Correct.
And I know, Dr. Rogers, you don't produce the budget request, so this is not directed at you personally. But I want to raise once again for the committee and the public my bitter opposition to the Trump administration's proposal to cut the CDC budget by more than half in fiscal year 26, which will have a devastating impact on epidemiological defense and health research to defend the American public from deadly diseases. And I would note, Madam Chair, that the administration's budget request proposes to eliminate entirely the CDC's diabetes division responsible for data collection and research, and to eliminate entirely the CDC's division of nutrition, physical activity, and obesity. And I will fight this effort to destroy the CDC with everything I have as a member of the United States Senate. And if we, on a bipartisan basis in the Senate, do not defeat this effort to gut the CDC, the American people will pay for it in lives, in suffering, for decades to come. And I want to thank you again, Dr. Rogers, for your work at the NIH, and respectfully request your assurance that any information that the committee may need in order to better understand your activities and also your collaboration with the CDC and the vital role that the CDC plays in defending the nation, you'll provide to the best of your ability to this committee. Do I have that assurance?
You have it, Senator.
Thank you, Dr. Rogers. I want to ask you also about ensuring that diverse communities across the United States have access to information and treatment. I note with concern that of course, diabetes impacts every community in the United States. And in Georgia, the Hispanic community, Hispanics in Georgia are about 1.5 times more likely to be diagnosed with diabetes. There was a project at the University of Georgia, an NIH grant had been awarded to help develop new tools with language access, bilingual and multilingual tools to help improve the Hispanic community's access to information about diabetes, about staying on top of insulin and blood sugar levels and treatment, as well as to be able to diagnose diabetes earlier. Can you speak broadly, please, Dr. Rogers, to the importance of ensuring that diagnostic tools and treatment information are widely accessible to diverse communities across the United States?
Well, I would say that goes without saying that my current director has mentioned that at his hearing, that we want to make sure that advances in medical treatments serve all communities.
Thank you, Dr. Rogers, and I'll be following up with the director's office about this canceled grant to the University of Georgia. Again, I know that's not your decision and your prerogative, but appreciate your work on behalf of the American people and your presence here at the hearing today.
Thank you.
Thank you. Thank you, Madam Chair.
Thank you.